I'm about to reveal something that could literally save your life. Something you can see right now, just by looking in the mirror. Your face is sending you urgent warning signals about serious health conditions developing inside your body. Conditions like brain tumors, strokes, and autoimmune diseases. And most people completely miss these signs until it's too late. I'm Dr. Sarah, and after 7 years specializing in geriatric medical problems, I've watched too many patients come to me after ignoring facial warning signs for months or even years. By the time they finally sought help, their conditions had progressed to dangerous, sometimes irreversible stages. But here's what makes me so frustrated. Many of these conditions were 100% visible on their faces weeks or even months before they developed serious complications. The signs were right there. They just didn't know what to look for. Now, I'm not going to tell you exactly what these facial warning signs are just yet, because if I reveal everything right now, you might think you understand and click away before learning the critical details that could actually save you or someone you love. What I am going to do is walk you through real patient cases, people just like you who noticed something unusual on their face but didn't realize what it meant. You'll see exactly what these warning signs look like. You'll learn the simple tests you can do at home right now, and most importantly, you'll understand when to seek immediate medical attention. Because here's the truth that most doctors won't take the time to explain. Your face is a diagnostic window into your entire body. Changes in facial redness, facial symmetry, skin texture, even the way you blink. These aren't just cosmetic issues. They're emergency signals from your cardiovascular system, your brain, your hormones, and your immune system. If you're over 50 and you want to learn these life-saving facial warning signs, comment, "Yes, I do, OG Sarah," right now. Let me know you're with me on this important health journey. But before we dive into the specific warning signs, I need you to understand something critical. Let me tell you about Margaret, a 68-year-old retired teacher from Ohio. Margaret was someone who took pride in her appearance. She got her hair done every 2 weeks, wore makeup daily, and looked at herself in the mirror multiple times every single day. So when Margaret started noticing changes in her face, she definitely saw them. But like so many people, she made a critical mistake. She assumed these changes were just part of getting older. It started with what Margaret thought was adult acne. At 68 years old, she suddenly developed small red bumps across her cheeks and nose. "I haven't had acne since I was a teenager," she told her daughter. "Why is this happening now?" Margaret went to her local drugstore and bought expensive acne creams. She tried different face washes. She even cut out chocolate and dairy from her diet because someone told her that might help. But nothing worked. In fact, over the next 3 months, the bumps got worse. But Margaret trusted what she read online. Every website said adult acne was common, so she kept trying different products, spending hundreds of dollars on treatments that weren't helping at all. Then Margaret noticed something else. Her face was always red now, not just where the bumps were, but a persistent, deep redness across her entire central face, her cheeks, her nose, her forehead. She felt like she looked flushed all the time, like she'd just come in from the cold. "I thought maybe it was hot flashes," Margaret later told me. "I'm past menopause, but I figured maybe this was some weird delayed hormonal thing." But here's what Margaret didn't know. What she thought was acne wasn't acne at all. You see, Margaret had rosacea, a chronic inflammatory condition that affects over 16 million Americans and is one of the most commonly misdiagnosed facial conditions in people over 50. But rosacea isn't just a cosmetic problem. It was a warning sign of the vascular and inflammatory changes happening throughout Margaret's entire body. The critical diagnostic feature that Margaret missed, and that could have saved her months of frustration, is this: rosacea never presents with blackheads or whiteheads. If you look closely at skin with rosacea, the pores are actually clear, but acne always has those comedones, those clogged pores. Margaret had been treating herself for the wrong condition for 6 months, but what happened next was even more concerning. Margaret started experiencing severe flushing episodes. Her face would suddenly turn bright red and feel burning hot. These episodes happened multiple times a day, triggered by things like drinking coffee, going outside, even just getting slightly stressed. During one particularly severe flushing episode at her daughter's house, Margaret also noticed something terrifying. She felt short of breath. Her heart was racing. She felt dizzy and lightheaded. Her daughter immediately called 911, thinking Margaret was having a heart attack. At the emergency room, the doctors ran extensive tests. Margaret's heart was fine, but what they discovered was alarming. Margaret's chronic facial redness and flushing weren't just rosacea. They were warning signs of significantly elevated blood pressure that had gone undiagnosed for years. The persistent facial redness, what doctors call plethora, combined with her flushing episodes, were vascular warning signs. Her small blood vessels were dilated and damaged, visible right there on her face. And the same vascular damage was happening invisibly throughout her entire body, putting strain on her heart and increasing her stroke risk. Margaret's doctor later told her, "Your face was trying to tell you something was seriously wrong. We just needed to listen to it." Margaret was immediately started on blood pressure medication and proper treatment for her rosacea, but she had lost 6 critical months treating the wrong condition while her cardiovascular risk climbed higher and higher. If Margaret's story resonates with you, if you understand why facial changes should never be ignored, comment, "Yes, I do, OG Sarah, so I know this information is reaching the right people." Now, Margaret's story had a good outcome because she eventually got the right diagnosis. But not everyone is that fortunate, and that's exactly why I need you to understand these warning signs. Let me show you exactly how to tell the difference between harmless skin conditions and serious warning signs on your face. First, let's talk about what I call the acne mimics, conditions that look like acne but are actually completely different. This is critically important for anyone over 50 because true acne vulgaris typically starts in adolescence. If you're suddenly developing what looks like acne after age 50, it's almost certainly not acne, and treating it as acne will not only waste your time and money, it might delay diagnosis of something serious. Here are the 3 most common acne mimics you need to know. Number 1. Rosacea, the most common mimic. How to identify it? Background facial redness that never goes away, visible tiny blood vessels, telangiectasia, on cheeks and nose, bumps and pustules without any blackheads or whiteheads. Frequent flushing episodes, burning or stinging sensations on the face, often starts or worsens after age 40. The key diagnostic test. Look closely at your pores. If you have clear pores with no blackheads or whiteheads, but you have facial bumps and redness, it's not acne. It's likely rosacea. Why this matters? Rosacea can be a sign of vascular changes, high blood pressure, or inflammatory conditions affecting your entire body. Up to 50% of people with rosacea also have eye involvement that can damage vision if untreated. Number 2. Perioral dermatitis. The pattern reveals everything. How to identify it? Small red bumps around the mouth, nose, or eyes. Critical sign. The skin right next to your lip line stays completely clear, often triggered by topical steroid creams or heavy moisturizers. More common in women aged 40-65. The key diagnostic test. If your facial bumps are concentrated around your mouth, but there's a clear rim of unaffected skin right at the lip border, this is perioral dermatitis, not acne. Why this matters? This condition often indicates you've been using steroid creams on your face, which can thin your skin and cause serious long-term damage. You need to stop these products immediately. Number 3. Seborrheic dermatitis. Look for the yellow grease. How to identify it? Greasy-looking yellowish scales on the face. Affects nasolabial folds, the creases from nose to mouth corners, eyebrows, hairline, almost always accompanied by scalp flaking. Dandruff. Worsens in winter months. The key diagnostic test. If your facial condition produces yellowish, greasy scales rather than simple bumps, and especially if your scalp is also flaky, you have seborrheic dermatitis. Why this matters? This indicates yeast overgrowth and can be associated with Parkinson's disease, immune suppression, or nutritional deficiencies in older adults. If you're understanding these critical differences and realizing you might have been treating the wrong condition, comment, "Yes, I do, OG Sarah. I want to know the OG Sarah community is learning these diagnostic secrets with me." Now here's what you need to do if you identify any of these conditions on your own face. Step 1. Stop all over-the-counter acne treatments immediately. These will make rosacea, perioral dermatitis, and seborrheic dermatitis significantly worse. Step 2. Take clear photos of your face in good lighting from multiple angles. These will be invaluable for tracking changes and showing your doctor. Step 3. Schedule an appointment with a dermatologist within 2 weeks. Do not wait. These conditions can progress and cause permanent facial damage, including scarring and visible broken blood vessels. Step 4. At your appointment, specifically ask your doctor to check your blood pressure and evaluate for underlying inflammatory or vascular conditions. Remember Margaret's story. Facial conditions are often warning signs of systemic problems. But facial redness and bumps aren't the only warning signs your face might be showing you. Let me tell you about Robert, a 71-year-old former engineer from California. Robert's story is going to show you why paying attention to subtle facial changes can literally save your life. Robert noticed something unusual. One morning while brushing his teeth, when he smiled at himself in the mirror, something looked off. His smile seemed slightly crooked. The right side of his mouth didn't quite lift as high as the left side. "I thought maybe I'd slept funny," Robert told me. "Or maybe I was just tired." But unlike Margaret, who ignored her facial warning signs for months, Robert did something that would save his life. He immediately did a simple test that everyone over 50 should know. Robert stood in front of his mirror and performed what doctors call the facial symmetry assessment. First, he raised both eyebrows as high as he could. Both sides moved equally. Second, he closed his eyes as tightly as possible. Both eyes closed completely. Third, he showed all his teeth in a big smile. This is where he saw the asymmetry. The right side of his mouth didn't move as much. Fourth, he puffed out both cheeks with air. Both sides held the air equally. Robert had 3 out of 4 tests normal, with only the smile showing asymmetry. Now, most people would have dismissed this. It's probably nothing, they'd think. I'll wait and see if it gets worse. But Robert had recently watched a health video about stroke warning signs, and he remembered one critical fact. Facial droop is a medical emergency. Robert didn't wait. He didn't see how it goes. He immediately called 911. Within 20 minutes, Robert was in the emergency room. The emergency doctor performed a comprehensive neurological exam. Robert could lift both arms equally. His speech was clear. He had no numbness or weakness anywhere else. The doctor explained to Robert that he likely had Bell's palsy, a condition where the facial nerve becomes inflamed, causing temporary facial weakness. This is generally not dangerous and usually resolves within weeks to months. But, and this is critical, the doctor also explained that facial droop can be the first sign of a stroke, and the only way to know for certain is through immediate medical evaluation and brain imaging. They performed a CT scan of Robert's brain, and this is where Robert's quick action saved his life. The scan showed something the doctor hadn't expected. Robert didn't have Bell's palsy. He had a small brain tumor pressing on his facial nerve. The tumor was still small and hadn't caused any other symptoms yet, but it was growing, and if left untreated, it would have eventually caused much more serious neurological damage. Because Robert caught it so early, literally the first day he noticed facial asymmetry, the neurosurgeons were able to remove the tumor completely through minimally invasive surgery. Robert's facial function returned to complete normal within 6 weeks. His neurologist told him, if you had waited even a few months, this tumor could have grown large enough to cause permanent facial paralysis, hearing loss, or even life-threatening brain swelling. Your decision to seek immediate help when you noticed that facial asymmetry quite literally saved your life. If hearing Robert's success story gives you hope, if you understand that quick action on facial warning signs can save lives, comment, "Yes, I do, OG Sarah," and be part of this informed community. Robert's story teaches us something crucial. Any sudden change in facial symmetry is a medical emergency. Period. No exceptions. No wait and see. You need immediate medical evaluation. But let me teach you the simple tests that could save your life or the life of someone you love. The facial symmetry assessment. Do this test right now. Test 1. Eyebrow raise. Stand in front of a mirror. Raise both eyebrows as high as you can. Both sides should move equally and create symmetrical forehead wrinkles. If one side doesn't move or moves less, this is abnormal. Test 2. Eye closure. Close both eyes as tightly as you possibly can. Both eyes should close completely with equal force. If one eye won't fully close or feels weaker, this is abnormal. Test 3. Show your teeth. Make the biggest smile you can, showing all your teeth. Both corners of your mouth should lift equally. Both sides should show the same amount of teeth. If one side doesn't move as much, this is abnormal. Test 4. Puff your cheeks. Fill your mouth with air and puff out both cheeks. Both cheeks should hold the air equally. Press gently on each cheek. Air shouldn't escape easier from one side. If one side leaks air or doesn't puff out as much, this is abnormal. If any of these tests show asymmetry that's new, meaning it wasn't there yesterday or last week, you need to call 911 immediately. Do not drive yourself. Do not wait for an appointment. This could be a stroke in progress, and every minute matters. Remember what Robert's neurologist said, time is brain. When you're having a stroke, you lose 1.9 million brain cells every minute. The sooner you get treatment, the better your outcome. But here's what most people don't know. Facial asymmetry isn't always a stroke. It could be Bell's palsy, which is generally benign. It could be a tumor, like Robert had. It could be an infection. The point is, you cannot diagnose this yourself. You need immediate medical imaging and evaluation. If you're still following along and understanding these life-saving tests, comment, "Yes, I do OG Sarah," so I know the OG Sarah community is really learning this material. Now let me show you some other facial warning signs that people over 50 need to know about. Beyond facial bumps and facial asymmetry, there are several other critical facial warning signs you need to recognize. Warning SIG number 1. Decreased blinking normal blinking rate. 1520 times per minute, or about 2-3 times every 10 seconds. Test yourself right now. Count how many times you blink in the next 10 seconds. If you blink less than once in 10 seconds, this could be an early warning sign of Parkinson's disease. Decreased blink frequency is often one of the very first detectable signs of Parkinson's, appearing years before tremors or movement problems develop. What to do if you notice you're blinking significantly less than normal? Schedule an appointment with a neurologist for a comprehensive Parkinson's assessment. Warning SIG number 2. Moon face, rapid facial swelling. This is a distinctive pattern where your face becomes unusually round and puffy, especially in the cheeks and temples. A simple test. If someone looks at you head-on, can they still see your ears? Or have your cheeks become so puffy that your ears disappear from a frontal view? Moon face develops when you have chronically high cortisol levels, a condition called Cushing syndrome. Other signs include fat deposits above your collarbones, fat deposits on the back of your neck, buffalo hump, easy bruising, very pronounced stretch marks on your abdomen, persistent facial redness. Why this matters? Cushing syndrome increases your risk of diabetes, heart disease, osteoporosis, and infections. It's often caused by medication, steroids, but can also indicate a tumor in your adrenal gland or pituitary gland. What to do? If you've developed rapid facial swelling, especially with these other signs, see your doctor immediately for cortisol testing. Warning SIJ number 3. One red ear if one of your ears repeatedly turns bright red and feels burning hot, but the other ear stays normal. This could be a sign of an autoimmune condition called relapsing polychondritis. The key diagnostic feature: the cartilage of your ear turns red, but your earlobe, which has no cartilage, stays completely normal colored. Why this matters? This condition causes your immune system to attack cartilage throughout your entire body, including the cartilage that holds your airways open. If untreated, it can lead to airway collapse and severe breathing problems. What to do? Take a photo during the next red ear episode, showing the difference between the red cartilage and normal-colored earlobe, and show it to a rheumatologist. If this information could help you or protect someone you love, comment, "Yes, I do, OG Sarah," right now. Let me give you the action steps you can take today. You now know that your face is sending you constant health warnings. You know that facial redness, bumps, asymmetry, and swelling aren't just cosmetic issues. They're urgent medical signals. You know the simple tests you can do at home right now, and you know when to seek immediate medical attention. But knowing isn't enough. You need to act. Here's exactly what to do. Action Step 1. Right now, before you finish watching this video, do the facial symmetry assessment I taught you. Test your eyebrow raise, eye closure, smile, and cheek puff. If you find any asymmetry, call 911 immediately. Action Step 2. Look at your face in good lighting. Check for persistent redness, visible blood vessels, facial bumps, or facial swelling. Take photos for your records. Action Step 3. Count your blinks for 10 seconds. If you're blinking less than once per 10 seconds, schedule a neurology appointment this week. Action Step 4. If you've been treating yourself for acne after age 50, stop all over-the-counter treatments and see a dermatologist within 2 weeks. You're probably treating the wrong condition. If this video gave you valuable information that could protect your health or help someone you love, comment, "Yes, I do, OG Sarah," right now. Let me know you're part of this community and that this information matters to you. Share this video with anyone over 50 who needs to know these facial warning signs. Share it in your family group chat. Send it to your friends. These are signs that save lives. Subscribe to this channel because I bring you the latest medical information that your doctor might not have time to explain. I cut through the confusion and give you actionable knowledge you can use to protect your health. Bookmark this video and watch it again. Review these facial tests monthly. Make them part of your health routine. This information could catch a stroke in progress, detect a brain tumor in early stages, identify dangerous blood pressure elevations, or diagnose autoimmune conditions before they cause permanent damage. Your face is talking to you. Now you know how to listen. Thank you for being part of the OG Sarah community and for watching all the way through. Take care of your health, and I'll see you in the next video.